Hello everyone. Dr. Reddy is with us and he's secured second rank in the INS exam that was conducted on October 25th, 2024. Dr. Reddy, we welcome you and many congratulations to you.
Thank you, sir. Thank you so much.
So INISS, you scored rank 2 in the arthroplasty category. And
Yes,
as
sir.
far as I have known, arthroplasty, not your first choice.
Yes, sir.
But I'm sure you are still enjoying this great feat because
Yes, sir.
after all, this is a great achievement.
Yes, sir. Yes, sir.
Okay. So, Dr. Reddy, as far as this exam is concerned, it's there in the arthroplasty category, pediatric orthopedics category, and spine category,
Arthroscopy also, sir.
and arthroscopy
Yeah.
and sports injury. That's the combined
Yes, sir.
category. Okay. So, sports injury, we have at AIIMS Rishikesh, one seat, pediatric orthopedics at PGI Chandigarh, and spine also at AIIMS Rishikesh. Am I right?
Sir, I think on Ped Ortho is in Rishikesh also, sir.
Okay, one Rishikesh also, a ped ortho. So two seats for ped ortho. And
Yes, sir.
arthroplasty
AIIMS Bhopal is, I think it is emerging to be next pediatric orthopedic seat, sir.
seat, yeah.
The
But
department
it's
is
not
growing.
there yet. Na? They
Yeah,
are
not there yet, sir, but they are planning to start one there also, it
one
seems.
there. And Bhubaneswar aiming for a spine seat?
Yes, sir. Bhubaneswar,
Not
Bhopal as well is also aiming, it seems, sir.
aiming it, but not
So
there. So right
it
now,
is in the pipeline. I think it may take some more time for it to become a reality.
maybe next year or a couple of years
Yes,
down
a
the
couple of
line.
years, sir. Yes, sir.
And arthroplasty, four seats. Bhopal,
Orthoplasty 4, sir.
Batinda,
Raipur
Rishikesh,
and Rishikesh.
and Raipur. Okay, fair enough. So what would your choice be? With the rank two in your category, you have fair bit of choices now. What are you?
Obviously, everyone's dream is to do it in Rishikesh, sir, but the rank one guy is taking the Rishikesh, so I'll be left with Bhopal, Raipur, and Batinda. I may
Okay.
opt Bhopal, sir.
Okay, so you're gonna opt for Bhopal. Last year
Uh,
also we had one of the topper opted for
yes,
Bhopal.
sir. Rahul Roy.
Yes, and we have had good reviews about the institute.
Yes, sir.
And perhaps, what I discussed with you earlier also, what I've seen that a lot of candidates, rather than, trying to be senior residents now, they are aiming for MCH degrees during the same tenure. Perhaps because of the more structured program, they get on the teaching experience, the degree additionally.
Yes, sir.
All these degrees, I have heard that there's a bit of trauma exposure also simultaneously that
Yes, sir.
continues.
In name cities there, sir. So for 6 months, almost every center will put you in trauma. I think it is there in Rishikesh and Bhopal. So Raipur and Batinda, they'll right away post you into orthoplasty. But
Okay.
Bhopal and Rishikesh, they'll post you for the first 6 months in trauma postings.
Trauma part. So that also goes. So Dr. Reddy, can you
So,
just brief us a little bit about your training, how your journey has been, and when did you actually make up this mind for going with the INSF?
sir, actually, I'm MS Ortho candidate of 2020 batch. I did my MS Ortho from Nizam Institute of Medical Sciences, Hyderabad. And I
Okay.
cleared my DNB after my MS exams, and I was actually doing senior residency in them. That is my 18th month of senior residency. So I have a lot
Okay.
of interest in trauma. So I continued working as senior resident in my institute itself, sir. It's my center is Apex Institute for both the Telugu states. So we get a lot of complex cases, neglected cases, a lot of TAST, spine scopy. We have pediatric orthopedics. We have exposure of every orthopedic branch in the institute, sir. We even do tumors. So there is
Oh,
no stone left unturned almost in our department. So I love working in my institute. So I've been continuing as senior agent here. And um, I gave my FMB last year and I got some 39 out of my interest in department. I continued staying here. And
oh.
I was preparing for INSS Spine. And I gave this exam in the last session. This is the first time I'm writing INSS for arthroplasty.
So three things, that come into my mind right now. So the first thing, that has come up, you were already in such a good department.
Yes, sir.
Second thing, you were a senior resident. So both things were giving you such a good exposure. Then why did you jump in for INSS?
Sir, every resident will have that urge to be an INI kid. So somewhere down the line, there will be it is dream of so many residents to do at least one degree in institute.
Degree. So you mean to
Yes.
say that degree carries definitely more weightage than any kind of
Yes, sir.
experience?
Yes, sir.
Yeah, I would also agree that, with the congestion so much increasing in this field, if you're a degree holder, you certainly have an edge over the average person. And
Yes,
I
sir.
think the course becomes far more structured also when you
Yes, a
enter.
more structured course. I think all the subspecialties of orthopedics, they do need formal training. So you cannot just
Oh,
go and work with some consultant for 3 months, 4 months, and you cannot just learn things in 3, 4 months. So there
yes,
is
you're right.
the
So
learning
you
curve
mean,
is pretty long, and you need at least decent kind of experience and training to go ahead with practice or
yes, you are
anything.
right. So more structured, a 3 years course that is adequate in a way, and then getting a degree, a salary, everything, which adds
Yes,
on
sir.
to the senior resident part. So obviously, I can see that most of the senior residents, like you have been, they are now aiming for degrees in their senior residency tenure. Wonderful. The third most crucial part, you've just told us your dream has been spine,
Yes, sir.
and you're picking up arthroplasty as of now. So what is, the break you have planned here, that how would you go from arthroplasty to spine then? Or would you just persist with arthroplasty, changed your dream?
No, sir. I still have my love towards spine surgery, and I will still prepare for spine surgery. And I'm planning to give spine surgery exam in the coming session. But there is only one seat, and pertaining to the uncertainty of securing that seat, uh, I'm planning to take this seat for now. And I'm interested in orthopedics. Not that I don't like orthoplasty, because but I'm more inclined towards spine surgery.
So spine your first love, arthroplasty your second love.
Yes, sir.
You will make the bargain if you are unable to go into spine, but you will
Yes,
make
sir.
an attempt to still go into spine if
Yes,
possible.
sir. Yes,
No,
sir.
that's very interesting, because most of the people are very unaware, like whether such a shift is possible or not. So can you give us some insight, like how would you then shift in case you get the desired rank?
So institute like AIMS will not hold you back from leaving the seat if you have a better opportunity or if you're not happy with the course. Sir. You can actually leave the course at any point of time. So, but there is some monetary conditions. Before 6 months of course starting, you can leave with paying a 3 lakh compensation and 1 month stipend. Sir. If it is after 6 months, it is 5 lakhs plus 1 month stipend. Only thing is you will have to inform the institute 1 month prior so that they'll withhold that last month's salary, and the rest of the amount you'll have to pay as compensation.
Compensation. So that's not a very big compensation either, manageable
Yes, sir.
for most of the people. So
Yes,
three
sir.
to 5 lakhs compensation, and you can reappear for another desired branch and shift the branch. That's excellent.
Yes, sir.
So with those kind of provisions, I think that's just the perfect step, that's there in your mind.
Yes, sir. Yes,
And
sir.
of course, give you best wishes for that another attempt.
Thank you, sir.
So I think this particular attempt, uh, so 80 marks was the MCQ paper and 20 marks you had the
Yes, sir.
interview. So in the
Yes, sir.
MCQ paper, what was your score?
It was around 54, sir.
54. So out of 50, you mean around 55 is a good score to achieve if someone
Yes,
has.
sir. Yes, sir. Yes, sir.
Okay. The MCQs, I suppose, were more from arthroplasty side, or were they equally distributed across orthopedics?
Yes, sir. Around it is like 70%, 75% questions will be from the branch which you are intending to take, sir, and the rest of 20 to 25% will be from the parent department.
Yeah, almost all of orthopedics,
Yes,
think
sir.
pediatric
Yes, sir.
orthopedics, tumors,
Yes,
trauma,
sir.
everything. So I think they've been following quite the FNB pattern in this way, where they divide 60% into the parent branch and
Yes, sir. Yes, sir.
40% they'll go through all of orthopedics. Okay. So around 55, you say, is a very good attempt score if you can achieve. Was there negative marking also there?
Yes, sir. It is plus one minus one third.
Okay, so one third is the negative marking. So having 54 despite one third negative marking means that you need to have a good attempt. So around 60
Yes, sir.
have to be correct. Okay, I can very well get it. So how do you rate up the difficulty level of the paper in MCQ context?
Sir, actually, it was very difficult, sir. Most of the questions are on revision surgeries.
Revision, sir.
Almost all the replacement questions were concentrated on hip and knee. If I'm not wrong, no question was asked on shoulder, ankle, and elbow orthoplasties. All
Oh,
questions were around knee and hip, but they concentrated more on revision
review.
surgeries.
Okay. So what sources you used to prepare for a difficult exam like a NSS?
Sir, I used I studied from Miller, sir. Miller's was my main source of
Okay.
uh, revision, and I practiced MCQs from Target Ortho, AOS, and
Okay.
sir.
So, how did you find the MCQ bank at Target Ortho? Was it sufficient? Were the explanations easy and
Yes, sir.
enough
Explanations are very good. Because the most advantage of the Target Ortho is the explanations part, sir.
explanations part? Yeah,
You get
because
lot of information just by going through the explanation part. It
um,
is not that always questions come directly from what is in target, but if you cover the explanation part, it solves most of your queries and it helps in navigating through the difficult scenarios, sir.
you're right. And did you go through some lectures also in the arthroplasty, arthroscopy category and spine category before the
Yes, sir.
exam?
Difficult areas I went through, sir.
You went through some lectures. Were the
Yes, sir.
lectures informative?
Yes, sir. Lectures are very informative, sir.
Okay, great. So those things benefited you. And then there is a group, WhatsApp group we have.
Yes, sir. Yes,
So,
sir.
so
I'm not an active player in that, sir, but I follow it.
you followed it. So you
If there are
found those.
any personal doubts, I think I messaged you a couple of times and you are
Yeah.
very prompt in answering
Yes,
back.
we
Yes, sir.
had,
Yeah,
yeah. But I
yeah.
always generally encourage you to put it in group because then
Yes, sir.
everyone benefits and some people who are not active players also,
Yes,
they
sir.
get some kind of a feedback. That's great. Okay. Now after this theory exam, the result came out and where I think almost three times the number of candidates are called for
Yes,
interview
sir.
uh,
16 candidates qualified in orthoplasty, sir.
in
12 were
arthro.
called for interview.
Okay, so once that is done, you go ahead with an interview. Now, there are so many, apprehensions people have regarding an interview. The first thing, it's holding just 20 marks, and then in
Yes, sir.
theory also, just your score was 55. So there's not much of an edge.
Yes,
Someone
sir.
who's from the same institute can be given that little bit of extra margin. So was that apprehension also there because you were not an
Yes,
INISS?
sir. That apprehension is always there, sir.
Okay,
Uh,
so this time, we've had two people who've scored, ranks 2 and 3 amongst the top three, and they've not been the INISS,
yes, sir.
candidates earlier. So somewhere down the line, I feel that, the INISS people are also breaking this now rule. They're not just taking in their inner candidates. They're giving
Scoring better marks in the theory exam gives you that edge, sir.
gives you
If you
edge.
cannot score good, you will not be in the race, sir.
It is, yes. So that is what has happened this time. People who scored well in the theory exam, even though they were not having an ISS background, they were able to be through with the interview likely because, the merit is being given some consideration, at least better than
Yes, sir.
before when people are turning up. So in the interview part, those 20 marks, what kind of questions did you face? Were they all from arthroplasty part only? Were some other areas
Uh,
also?
no, sir. That day there were three interviewers. One was asking about spine, one was asking about hip, one was asking about knee.
Okay, so they had the examiners had divided areas among them.
Yes, sir. The person who asked spine also asked some research questions, sir.
Research question.
Spine
So
and
this has
research
been very
was from one surgeon, and the other two took hip and knee, sir.
okay. So we've persistently, got that feedback that some questions on research always come, and many candidates get trouble
Yes,
with
sir.
it. They are generally not well prepared with the research-based questions.
Yes, sir.
Okay. So do you recall some kind of questions that were put to you so that we can gauge the
Uh,
difficulty level?
from research, sir, or
Research questions especially.
research, I was asked about PICO, sir, PICO, PACO, patient
Oh,
interventions, controls, and outcomes. It is a model used in this meta-analysis.
meta-analysis. Okay. So that was asked to you.
Yes, sir, that
So,
was asked, and some questions about my thesis and my observations and studies.
Okay, so your thesis is almost always discussed, what everyone
Yes,
else
sir.
would need. And then, from there they take you towards research because somewhere down the line they are preparing for another thesis
Yes, sir.
at the next level. So they expect that you should be having the basics.
Yes, sir.
Concerning the questions from arthroplasty part, like the theory paper, were they also focused on revision areas or basic principles were discussed?
In hip, they asked division, sir.
Okay.
I think they asked me about uh, spinopelvic relationship. They made me tell about everything in detail. And the other question was about the establer defects, sir.
Okay.
He
So
was
somewhere
not
down the
asking
line.
grade one, grade two, what is in and out, up and out. He was not asking. He was asking what do you actually look for in radiographs to classify them. The chorus
Oh,
line, the uh, teardrop. What do you actually look in to categorize them?
categorize. I got it. I got it. So somewhere down the line, what I can gauge that the interview is just an extension of the theory paper. So same preparation that you are carrying would help you out with bit of, interventions into that preparation by adding a bit of preparation to tackle research questions, tackle a
Yes, sir.
bit of questions on a practical side when you're into the interview. Otherwise, it's pretty much the same. Okay, fair
The
enough.
other surgeon, he asked me about instability of knee, sir. So, some
Okay.
arthroscopy was also touched upon. But how
All
do you
right.
check posteromedial instability? How do you check anterolateral instability?
Okay. So
The
some
patellar alta, patella baja, and the trochlear dysplasia
okay.
classifications.
More so again here, they were focused on hip and knee
Yes, sir. Hip, knee, and spine.
and spine and the
Yes, sir.
related. Yes, I got it. I got it. Not much of discussion on trauma, I suppose.
No, sir. No, trauma was not asked. Trauma only in theory exam. Trauma was not asked.
The exam. I got it. I got it. So that's like, your mind should be, your approach should be when you're preparing for this exam and going with the interview. But yes, you should never undermine the theory exam because somewhere down the line, those marks would be of great help in case you do not belong to the INSS
Yes.
fraternity earlier
Theory was bit on a tougher side, sir.
on the
They
top.
asked about uninis and the questions are very like pinpointed questions, sir. Uh, there are some questions like which is the most reliable sign of loosening. All four will be signs of
Yes,
losing. That's the most reliable sign.
liable.
And
And then you have to weigh them out. And
yes, sir.
so
Is it
I've
the
been
most
listening to
reliable? Is it
you.
the best indicator?
Uh,
Something
yes, so
like
I've
that. All four are right, but they want to be more specific.
okay. So reading those sources with that hide information, I can very well understand is very, very important in such
Yes,
context.
sir.
Okay. So many, many congratulations to you, Dr. Reddy. You
Thank you,
made
sir.
us all proud with such a great achievement. We wish you all the best for your
Thank you,
future.
sir.
Always say stay in touch and, keep guiding us also, with your great inputs that you've done as of now. So all the best. Great speaking to you, Dr. Reddy.
Thank you, sir.
Thank you. Bhavna, we can get done with the interview. So really great interaction, Dr. Reddy. Somewhere down the line, you've updated us so well to be
Thank you,
better
sir.
for the in future. And that's amazing. So
The
you're,
MCQ exam was very tough, sir. Very tough. Like which of the following is least possible complication of Oxford knee?
I know, I know. So did the
Unions are
exam,
not at all practiced in many centers. And most of
many,
the orthopedic surgeons also they don't operate unions. They are
I know.
like which complication is which is the least possible complication of Oxford knee syndrome? That's the first question I saw.
So
I got bamboozled.
I can understand. But I'll tell you a very simple thing that the exam, if it is not kept tough, choosing the
Yes, sir.
candidate for so less seats will be very difficult.
Yes, sir.
So this has been specifically the purpose of both FNB and the INSS exam to give it a difficulty level so that they are able to shunt out people. Otherwise, it will be very difficult. And with so much of congestion in the branch, the people, the candidates who are appearing are going high and high every year.
Yes, sir.
That is their challenge. So, you have to allow them to put in
Yes, sir.
that
Outside
difficulty.
opportunities also they're becoming harder. So they just want to escape the environment and get into some course.
Some course, but I would
Yes.
tell you, being myself an FNB, of one of the earliest exams, 2014 is when I cleared my FNB
Oh,
and I joined arthroscopy at that time. So this post MS degree definitely gives you an edge. I have been the perfect case control study. I was in a center, I did my FNB, I came back to the same center, and trust me, my OPDs changed, my
yes,
scenario
sir.
changed. Perhaps because uh, when you do these degrees, your expertise certainly increases in that particular field.
Yes, sir.
Why you are calling the exam difficult, I'll tell you in a very simple way, because uh, what is difficult is what is not routinely seen. You're not seeing any knees, so
Yes, sir.
after this now those things will become routine and they would become
Yes, sir.
easy for you. So that is what I felt with myself, that earlier the things that were difficult for me were becoming easy. So my expertise in that field was increasing, and that is how my patient load was increasing. So you will feel the difference, from my experience when you will go down and practice in your field. But I would still convey my best wishes for that leftover part, the spine that you are
Yes, sir.
practicing. So may you also be able to enter your dream branch. But
Thank you, sir.
nevertheless, the bargain also you have done is an excellent bargain. It's good in its own way. But
Yes, sir.
still, best wishes from my side for that
Thank you,
last
sir.
year as well. Great, Dr. Reddy. Stay in touch.
Thank you.
Pleasure to
Sure.
interact with you.